Hi, welcome to Nursing Research. This will be a tutorial video on week 1 of Nursing Research. We'll be looking at just an introduction to the course, looking at reading an article abstract together, trying to pick out parts of that PICO question, and then I will end with a brief overview of what your final project will be for this class. So let me share my screen with you and we'll go through a couple of the PowerPoints for this course. All right, so what is nursing research? Nursing research is the systematic and rigorous kind of critical investigation that is looking to answer questions that we see occurring in our nursing practice. Researchers follow very specific steps in kind of answering these questions, and there's two types of research that we're really going to focus on in this class. Qualitative, where we are using words to kind of qualify what somebody's experience was. What is the experience of, what does it feel like to be an intubated patient, for example? And then quantitative, where we take, again, looking at something and we're trying to assign numbers to it. What does a patient's blood pressure and heart rate do when they are intubated and in pain? Again, many things that we can measure and that we can look for causation between or correlation of the factors that we're experiencing. Again, this is a nursing research class, so we will be looking primarily at research that is done within the discipline of nursing. Research and evidence-based practice are built on one another. They are part of a triad that we will look at here in just a second. But again, nursing research is really a systematic approach to trying to logically answer questions that we experience in our nursing practice. Evidence-based practice is then the use of that interpretation and integration of research that has been done by nurses, and we combine that with the clinical expertise that we as nurses have, and we always need to make sure that we are taking into account patient and family preferences too in how we go about providing care. So again, evidence-based practice is kind of the culmination of the research that we have done, our own clinical expertise, and then the desires of the patient and family and how their care is provided. As I said, this is part of kind of a dyad of things here where we have our best kind of external advice, or evidence. That's our research. We have our own kind of clinical expertise and practice, and then we have those patient values and expectations. And in the middle is kind of where that evidence-based medicine or evidence-based nursing comes into play. Why would you be taking a nursing research class? Again, we as nurses are asked to be kind of the experts of providing our patients with the care that they are receiving, giving them the correct education on things, and so we need to be knowledgeable consumers of research and making sure that we understand research so that we can be using it and putting it into best practice. Think for just a moment of times in your practice when you use nursing research. Hopefully that is in the care that you give your patients as far as the different policies, guidelines, and so on that you follow. Oftentimes the research process can be kind of a circular process where you start out thinking that you're interested in a certain topic, and through your exploration of that topic, it leads you down other trails of like, oh, I hadn't thought about this when I started on this, but this is an interesting thing to look at. So research is not always a linear process, and that can be sort of frustrating from time to time for people. But again, just open yourself up to kind of it feeling like a bit of an exploration. As the slide says, at any stage, researchers may find that they need to step back and kind of rethink the step that they took, and that our research can always lead us to selecting and defining more problems that we can research into the future. The research process, as you see here, is a multi-phased process, and we will kind of begin at the phase 1 here. For week 2, you are going to start selecting and defining a problem. That'll be that PICO thing that we'll talk about here in a moment. But select and define a problem. We want to identify what the problem is and what our purpose statement is. What's the purpose of the research that we're trying to do? Then we want to go to the literature. We are going to use CINAHL primarily for this class, and we want to be looking at the literature. What's already been done out there around our topic of interest? What are the variables that we need to take into account? And again, then forming our question or our hypothesis of what do we think we're going to find. Phase 2 would involve selecting a research design where we decide who our sample is going to be, who are we going to look at when we're conducting our study, what kind of setting do we want to use, and all the parameters or measurements that might go into our study. Phase 3 would be our method, and that's the different tools that we might use to collect data from people. And then we're going to analyze that data, interpret the findings, and finally in Phase 5 we get to go into research utilization where we're actually publishing that or giving educational in-services or creating new policies, really making sure that we're disseminating what we found. And as the previous slide said, sometimes your research leads you to other trails, and so you typically at the end of one research project may start back at Phase 1 of now there's other things that I want to explore related to this. Different types of nursing research for us to look at are, again, qualitative and quantitative. As you can see in this slide, qualitative, again, seeks to understand the meaning of human experiences, usually conducted in a natural setting, seeks to describe the experience. It is a subjective approach, and the whole point is that if I can understand the experience you're having, perhaps I can generate a theory out of this. Maybe there's something that can be disseminated to others from your experience. Quantitative seeks to look for relationships. It's looking to answer that question, again, conducted in a natural setting or in a lab, depending on the experiment itself. It is seeking to, again, describe a phenomenon. It is more objective in its approach, and this is often used to test theories rather than to generate theories. In this slide here, you're seeing the levels of evidence, and we will use this throughout our course as we are looking at our literature review grids. It's a pyramid shape with level 1 being kind of the highest level of evidence that there is, the most stringent level, if you will, going all the way down to level 7. Level 7 is looking at opinions of authorities and reports of expert committees. So again, there is levels of validity to this. At every stage of this has valid approaches to how they are doing their studies, but it is worth us noting as researchers that they're not all the same in the kind of level of rigor that goes into them. So, for example, I myself could write probably an opinion article at level 7 based on the knowledge that I have as being a clinical expert in neonatal intensive care, but that would not be the same as level 1, where there have been all these very systematic experiments conducted and then analyzed and so on. So again, all levels have their own validity to them and their uses, and we just need to kind of decide as we're looking at research articles which level of evidence is your research article. So levels 5, 6, and 7 all tend to be qualitative studies, and you can see that right here in the pyramid themselves. A level 6 study is one single study that is done at the qualitative level. Level 5 study, here it says a systematic review. So again, we're looking at multiple studies, multiple qualitative studies at this point. And then levels 1 through 4 are all in the quantitative realm of things. And we will go into these in more depth in weeks 2 and 3. But again, it's just good to differentiate that the top of the pyramid deals more with quantitative studies, and the bottom of the pyramid tends to deal more with qualitative studies. Again, what is a level of evidence? It is not a critique on how well the research was done. It is simply a rating given to a method of research. It is likely to tell us how much this research is determining cause and effect. Again, the higher you go up the pyramid to level 1, the more closely related cause and effect can be determined. One thing that's important to remember is that a study can have a very high level of evidence and yet can still be a poorly conducted study. So you need to have the skills to be able to critically analyze them. Giving care. What matters when you're making evidence-based decisions? Again, when we are caring for our patients, we want to make sure that we are using quality research that is seeking to minimize bias, that there are enough studies that we can really feel a sense of, yes, this has validity to it, that there's been enough rigor done with this. As it says here in the slide very clearly, one study is not enough to change your practice just based on one study. It may be an interesting study, but that should just lead you to seek more studies to confirm what that study is saying. Again, when we are looking to implement research, we're looking for consistency. We want the same findings to pop up time and time again, that we have some level of certainty that this really is what will create better care for our patients. We oftentimes use clinical guidelines. Those can be based on experts who are looking at research, that are developing these guidelines. Different areas of nursing have their own, professional boards that may put out guidelines for critical care, guidelines for emergency care. So again, those guidelines that you follow in your specialty area are based on experts that are doing this research for you, oftentimes at the national level through your professional organizations. Again, the reason that we use guidelines is that it helps us to bridge putting the research that's been created into practice at the bedside. You'll oftentimes see these algorithms or pathways used for clinical management of specific diseases or treatment plans. What is it that I hope that you are able to take from this course? I hope at the end of the 7 weeks that you feel a bit more of a sense of being able to open an article and determine, is this qualitative or quantitative? Once you decide what kind of article it is, okay, what kind of level of evidence is this? What type of design did they use in this article? I just want you to have an increased familiarity in being able to read articles and kind of have some basic understanding of them. I would like you to appreciate the multiple steps that go into producing nursing research, and then increasing your confidence to be able to apply this at the bedside. Of course, I would always like for you to work on increasing your ways of thinking about things and to have a more critical approach to the care that you're giving, and to feel like you have further tools to deepen your critical thought process. Let me stop sharing this PowerPoint with you, and we will switch over to the abstract PICO one here for a moment. Okay, so again, this PowerPoint that we're going to go over is looking at reading an abstract together and creating our PICO questions. We are going to be looking at the various things that go into an abstract, and here they are outlined for us. Within an abstract, and again, you can look on page 473 in your textbook if you'd like to see an article similar to this to follow along. There's an introduction, as part of your abstract, which would define the purpose of your study, would go over the literature review and kind of whatever theoretical framework was used in creating this article. And then there would be either implicitly stated what the hypothesis or research question is, or sometimes you actually have to read through the article and try and decipher that yourself. An abstract will tell you what kind of methods were used, what the research design is, what kind of sample they were studying. It will have different instruments, data collection, and data analysis methods overviewed. It will give you the results, and there will be a discussion section which talks you through what the results mean. There's also a very important section that looks at recommendations and implementations for further use. This is an important section for you as a practicing nurse to really think about. I want you to be able to critique this article and say, what pieces were missing? What areas could be researched in the future? What knowledge did I gain from reading this article? Really kind of critique the article of what are the limitations and what are the potentials that you can use in your nursing practice. And then again, there would be a references section as well. An abstract should, again, give you the purpose of the study, the type of the study, the methods, basic results, sometimes the clinical relevance, and the PICO question that that article is answering. We're going to look at an article called The Effect of Cognitive Stimulation on Nursing Home Elders, and it tells us right here what kind of design this is. This is a randomized controlled trial. So when we start a literature review grid, the first column that you're going to see asks you for the APA reference. So again, here is the journal that you would find, the different authors, that sort of thing, to do that reference for us. The abstract begins with the purpose, the paper. This paper describes the effectiveness of cognitive stimulation therapy on cognition and depressive symptoms in older adults in nursing homes. The design, this was a randomized control trial carried out from 2012 to 2013 and included 56 residents from 4 nursing homes. 36 were women and 20 were men. They randomized these people into experimental and control groups, and of note, 8 participants dropped out throughout the study. Participants of the experimental group underwent 14 cognitive stimulation therapy sessions over 7 weeks. These were in groups of 6 to 8, and the participants of the control group just received the usual care. So we have an experimental group getting cognitive therapy. We have the control group going about their daily lives. There are some baseline tools that were used here at baseline and then after the interventions to kind of measure, did this therapy have any effect at all? And so they used a Montreal Cognitive Assessment, the Geriatric Depression Scale 15, and the Barthel Index of Activities of Daily Living. What did this study show? This study was able to show that cognitive therapy increased cognition. However, there were no statistically significant differences in depressive symptoms. The baseline level of activities of daily living did not affect the outcome. So again, what this is telling us is if I was a highly active, independent person beforehand, or if I was a very sedentary, needed lots of help with my activities of daily living, that played no effect in this study. In conclusion, the cognitive therapy had significantly improved cognition, but there was no statistical evidence of its effectiveness on depressive symptoms. And again, as I said, the improvement was not affected by their baseline ability to do activities of daily living. So what is the clinical relevance of this? What this is trying to show us is that using this therapy, which provided activities, general stimulation for concentration and memory, oftentimes happen in a social setting, that all these different components of that could be highly impactful on elderly people in their independence and autonomy if we're increasing their cognition. And then it also may have an economic impact because, again, if they are more cognitively alert and aware, Maybe they are less likely to fall, those sort of things, which again have direct costs to us. So lots of good things that could come from implementing a system like this. What was the PICO question that this study was trying to answer? A PICO is a clinical question. It's a format that we as nurses use to kind of help us formulate a question that we're having. It helps us be succinct and to the point, and it helps us in guiding our research to look for answers to the question we're asking. So PICO, population. What is the population we are looking at? What is the intervention? What is the comparison? And what is the outcome? So in this study, elderly adults who live in nursing homes, that was our population of interest. Does cognitive stimulation therapy, that is our intervention, our interventional group, as opposed to no cognitive stimulation therapy. So again, our control group were just people that were going about their daily lives. Our outcome is, did those result in improved cognition or improved depressive symptoms, our outcome, over 7 weeks? Oftentimes you can add a T piece, which is a time element to it. So again, these are the components of our PICO question: population, intervention, our comparison group, and our outcome. And the last slide that I was going to go over is our final project slide. Share this with you. Again, this final project will be sort of determined based on your size of your group that you're a part of. Everything that you will see here is based on this being a group project, and your instructor will give you further guidance into how many people should be a part of your project, or if you're part of a small group, is this going to be an individual project? But for the sake of instructions, we will go over it as a group project sort of thing. So this final project has been built to be done with at least a partner or two. You are trying to come up with your burning PICO question that you really want to get answered. You're going to search the library, again, the CINAHL databases, and you're looking for 3 research articles. So each person in your grouping would have 3 research articles on the topic that you have chosen. And I believe week 5 of this course is when those final 3 lit review grids are due to be turned in. You will be needing those throughout to be working on your paper and your final project. We're looking at research as a whole, so it would be your individual 3 articles plus your partners, plus maybe you have 2 partners. So again, all the literature that you gather as a group will be looked at in making your final paper and your final presentation, PowerPoint, or poster. So for your final project, again, as I said, week 5, all those lit review grids are to be turned in. So this is an individual assignment. You do your 3 literature review grids, and people on your team will also do their own. Week 6, this is a group assignment for your paper to be completed and turned in as a group. And week 7, you will do your poster or, again, your PowerPoint presentation, and that is a group assignment as well. And so ideally, you would have that uploaded into Moodle by Wednesday of week 7, and that way your peers online can look at your presentations, and they will have a peer review grid and kind of do some grading of your presentation by Sunday of that final week. So first things that you'll want to start doing by week 2, midweek of week 2, you are to post a PICO question for discussion. So again, you need to start thinking about different PICO questions. What is it that you can change? What is part of your nursing responsibility? What bothers you in nursing practice? How can nursing practice be improved in your place of work? How could something within your nursing practice improve your patient outcomes? I really want you to think what is something that is doable for you and meaningful as you take this project on. So think of something that you would like to see change from kind of a clinical practice in your setting and work on creating 3 different PICO questions. Again, population, intervention, comparison, and outcome. You can add a time component if you'd like, but 3 PICO questions that you will need by next Wednesday. So let's go over your assignments for next week. Again, as I keep mentioning, you will need to have those 3 PICO questions that you have outlined for next Wednesday. Put those in the discussion post. You'll want to highlight or bold the one that you are choosing to do your research on. And then I would like you to find 3 articles in CINAHL this week through the Good Library, and just give a little summary of each of those articles. Again, this doesn't need to be anything more than just about a paragraph per article, just kind of outlining why that article relates to the PICO question that you're trying to answer. For week 2, you will also have an article that you are reading. It is assigned to you in Moodle. I believe it's in chapter 7 of your textbook. I want you to read that article, and I want you to work on completing a literature review grid. When classes started at the end of week 2, once those lit review grids are all turned in, I will create a tutorial video where we go through that literature review grid together. And it's kind of a way of self-grading, self-learning for you to walk through that lit review grid with me and see where I was picking out information, where I was kind of going with that, and so that we can all learn how to do lit review grids together. So we will do that week by week up through turning in our final lit review grids on week 5. Please contact your instructor and let him or her know if you are having any questions or any difficulties as this class progresses. And again, good luck with everything.